Hi guys! Today we're going to be talking to you about a disease that's kind of scary until you take the time to learn a bit more about it. We're going to be talking to you about Alzheimer's. We'll first be introducing the disease and then breaking down some of the common myths associated with it so you can walk away with a better understanding of how to support your friends or loved ones. So what is Alzheimer's disease? Alzheimer's is a neurological disease that affects the brain's ability to process memory, thinking, and behavior. It is a common form of dementia. An individual with Alzheimer's disease will lose normal functioning as cell death and tissue loss occur. You may be wondering what happens in the brain of an individual with Alzheimer's. For one, cell connections are destroyed. Cell destruction occurs in the hippocampus of the brain where memory processes usually take place. The outer layer of the brain begins to shrink and the space inside will become larger. Moreover, plaques and tangles also begin to form. As the disease progresses, it can affect not only memory, but also language, intelligence, and judgment. A common myth is that having abnormal brain connections will lead to Alzheimer's disease. That's not true. Studies have shown that people with brain abnormalities don't always develop the disorder. According to the cognitive reserve theory, the brain is actually able to cope with brain damage by using previous exposure and behaviors to help it function normally. These can include education, occupation, and leisure activities that can increase the cognitive reserve. This suggests that lifestyle changes can impact the way our brain processes information, helping some people avoid the development of Alzheimer's. People can sometimes confuse symptoms of Alzheimer's with the normal aging process. But individuals should not overlook symptoms such as memory loss, inability to learn new things, shortened attention span, and difficulty with familiar tasks, and should seek physician testing. However, it is a myth to think that memory loss immediately means a diagnosis of Alzheimer's disease. In reality, it is completely natural to gradually lose memory ability as you age. However, if you feel that the memory of someone you know is getting worse, such that it impedes their day-to-day living, it might be time for testing. Also, if you find yourself in the younger age cohort and think you're probably too young to even worry about diseases like Alzheimer's, it's a myth that only older people can get Alzheimer's. In fact, Alzheimer's can actually affect people in their 30s, 40s, and 50s. This is known as younger onset Alzheimer's. Once you have taken your concern to the next level, it's time for diagnosis. A full diagnosis of the disease is very important to ensure you have the right care plan moving forward. A physician may ask the patient questions about their overall health, conduct memory tests, ask them to complete cognitive tasks, or carry out standard medical tests or brain scans to rule out other possible causes. However, it's a myth among people that once you've been diagnosed with Alzheimer's, your life is over. If someone you know has recently been diagnosed, they can still live a fulfilling life. One study found that caregivers actually tended to underestimate the quality of life of the Alzheimer's patients they cared for, compared to the Alzheimer's patient's own self-evaluations. This was described as the disability paradox. This suggests there are many coping strategies out there that patients can employ to maintain a good quality of life, including socializing, incorporating a healthy diet, and being active. While many television programs might have you believe that there is an Alzheimer's gene or one genetic trait that predicts the future diagnosis of people with the disease, that's a myth. Genes do play a prominent role in diagnosis, but environmental influences are also at play. The heritability for the disorder is estimated to be 58%, which is still high, but suggests that environmental factors are at play too. That's not to say that genes don't have a role. Apolipoprotein E gene is the strongest risk factor for late onset Alzheimer's disease and is 60 to 80% heritable. New technologies provide fast and affordable techniques that allow an entire genome to be scanned in less than a day. This has allowed researchers to identify rare genes that influence Alzheimer's. So let's say a loved one has just been diagnosed with dementia. Now what? Supporting someone with Alzheimer's disease can be difficult. A good first step is to try to understand how the person might be feeling. They might be experiencing the world very differently from you or I, so it can be helpful for carers to offer support while trying to see things from the perspective of the individual. Caregivers may also find support from peer-based support programs where they can share their stories with others experiencing similar situations. We hope this video was educational and helped address some of your misconceptions around Alzheimer's. For more information about the disease or how to get involved, be sure to check out the amazing work of the McMaster Alzheimer's Society.